I just realized that there was really three main phases for patients in their dental journey, and I wanted to make sure that we could articulate that to our clients really simply and not over tech. You know, how many times do you hear, not just dentists, but just your physicians, your medical experts, heck, even your mechanic, describing things to you where you just have no idea what they're doing and you get caught kind of nodding and kind of glazing over. So I didn't want that for my clients. I wanted to figure out a way to better present treatment. And so what I found is we really define your care, no matter who you are. If you're somebody who just needs routine cleanings and says, I'm just here to get my teeth clean, or somebody that has a full mouth reconstruction in their future, what's the similarity there? Well, it's these three phases. So phase one is what I call foundational. And that means exactly what it sounds like, your gum and your bone. It's the foundation to what you use when you smile, eat, talk, chew, all that fun stuff, which is your teeth, of course. A lot of clients come in thinking that our focus as a dentist is your teeth. And some will add, yeah, you also clean my gums. But what we like to do is help them understand that we can explore all of these different parts that revolve around your oral health. And so that includes, and we've talked about this, your jaw joint, your headaches, your smile, obviously, your gums. Statistics show about 1/3 of the US population has what we call periodontitis, which just means periodontal disease or the loss of bone and gum attachment. It's a pretty important thing. If it goes back to my basics, it's I want you to keep your teeth for a lifetime. But why not have fun doing it? And then, of course, phase two is restorative phase. So we call that the restorative phase because sometimes patients have cavities or chipped teeth, or maybe they just need their teeth smoothed. Believe it or not everything in dentistry has to be heavily involved, very expensive or big investment. Instead of grinding teeth down for veneers, maybe I can just soften the edges of the chipped and worn edges and whiten the teeth. And so we can provide a lot of different solutions in restorative phase that help people achieve a better smile, better function, get rid of pain. There's a lot of layers to that. But phase two is restorative phase, just basically the rebuild, getting people back to where they want to be. And then phase three is elective care. And so that's the fun stuff. That's when patients feel like their foundation is healthy, they've got all of their disease removed, the cavities and the gum disease. And now we're talking about big picture or vision. What's your long view? I always tell clients we don't want to just look at the short view. Short view is I want to get you out of pain. I want to get you comfortable. I want to clean your teeth. But the long view is, hey, I noticed that your bite isn't balanced and you don't smile full in your pictures. One of the things we like to do is take a full series of photographs, because when I ask you to smile in those photographs, many of my clients that have chipped or crowded teeth will oftentimes, or even discolored teeth, will oftentimes smile like that instead of showing me teeth. So our relationship begins from the very moment we just start taking records, and I learn more about you even when you're not speaking. So phase three is that fun zone. It's that zone where you can say, hey, if you would do anything differently about your smile, what would it be? And ironically, people usually speak up and tell me things oftentimes I wasn't even aware of. And so that's kind of that co-discovery or that space and place where people can feel safe to create long vision.